In older people, a heart attack can often happen before cardiac arrest where the heart stops beating. But a heart attack, in and of itself, is not cardiac arrest.
So heart attack is a very general term that a lot of people use for a lot of different situations, but it can mean very specific things depending on who you are. But to a cardiologist, it means something very specific. So what I think of as a heart attack is a more specific term called a myocardial infarction, which will typically be an older person with some risk factors who would develop chest pressure, pain, shortness of breath, and that's caused by the arteries suddenly becoming blocked. What a sudden cardiac arrest is you have a cessation of your pulse and your heart can no longer pump the blood to the rest of the body.
In young people under 35, sudden cardiac arrest, while rare, is often caused by a thicker heart muscle and/or heart arrhythmias.
Sports like basketball, soccer, rowing, those sports have all been associated with bringing out those underlying issues. Swimming, yep.
Many of these heart conditions can go unnoticed, especially if certain red flags are ignored.
I'd say that anybody that actually does pass out should be evaluated by a healthcare professional. It might not necessarily be something related to the heart, but it could be a serious warning sign.
This is why pre-participation screenings are essential.
Some studies looking at population health have shown that about 1 to 1.5% of middle school and high school age kids do have a high-risk condition that's not identified.
Dr. Heffernan also says that if you're overly fatigued, dizzy, have chest pressure, and not at your normal peak intensity while exercising, those could be signs of a heart condition. If you do have a heart condition, it can be managed.
There's a variety of things, potential medications, some prophylactic, something like a defibrillator may be recommended, but not everybody has to stop playing a sport.
Sudden cardiac arrest is sudden. Intervention is needed immediately.
So in general, the only thing that you can do at that point is CPR, which is an important skill for, I think, everybody to learn.
Knowing CPR saves lives when seconds count, especially when waiting for the ambulance, which has an average response time of just under 9 minutes. Ed Russo, CBS 21 News.